Another uptick in pharmacy robberies in Toronto, despite mandatory measures now in place to protect them. The climbing number of violent incidents putting pharmacists on edge.
Within my close friends who are pharmacists, pretty much all of them have been robbed.
It has become an all too common experience for pharmacists in Toronto and the GTA. There have been 135 pharmacy robberies in Toronto so far this year. That's up 30% from this time last year and more than all of 2022.
I've been in the business for several years, and it's absolutely correct. Haven't seen anything as bad as this year.
The robberies are contributing to the escalating opioid crisis, and the street value of narcotics is up, making them an enticing product for thieves.
They're reaching upwards to $50 to $60 a pill. So we can imagine if one container is taken, how much money they can make off one container of pills.
But Toronto police now tell us the situation could be taking a turn.
We did see an increase in January and February. But then a considerable drop end of March into April, so the springtime. And it's been dropping ever since.
That's around the time it became mandatory for pharmacies in Ontario to install time-delayed safes, which prevent access even after a combination is entered until a preset time has elapsed.
It's only effective or most effective when everybody has them installed.
In BC and Alberta, the universal use of time-delayed safes, along with signs and other public awareness efforts, has significantly reduced robberies.
So we know it works. The data is very clear. But Ontario, because there are supply chain challenges and there's so many pharmacies, we've had to do what I would consider to be a phased-in approach.
Some pharmacies that have managed to get their hands on a safe tell us it has been helpful.
It's actually been great. It kind of gives that extra layer of sense of peace of mind for our staff. It does delay some things by 5 minutes, but we've just worked that into our workflow.
We like to think of ourselves as people who help out in the community. We like to think of ourselves as medical professionals, people that you come to when you're at your worst. And when something like that happens here, it feels like a gut punch, really.
The Ontario Pharmacists Association tells us they expect all pharmacies in Ontario to have time delay safes by the end of the year. For City News, I'm Tina Yazdani.